So you have this complex reality, but you also have a connection on the institutional level. In both instances, the move to push these issues of addiction and violence away from policing issues, away from personal failings needed to be deterred by police, to public health issues needing to be dealt with by services, have the positive impact of decreasing the amount of people incarcerated on some of the lower ends of the scale for addiction and so-called violent crime. I mean, violent crime is everything from, having a loud argument to murder. Not all of it requires, obviously, arrest. But you have the flip side of that response, which is public health institutions, academic institutions deeming themselves experts in the ways to address these public health issues, bringing public health methodologies from the colonial public health practices overseas, bringing abstract academic quantification focused methodologies to very deep, complex psychological, spiritual issues of addiction and violence. And sometimes well meaning, but I think sometimes very much understanding that they want to monopolize this growing industry of addiction treatment and violence prevention services, basically deeming themselves the experts in the space. And at least in Baltimore, it's not true everywhere, but in Baltimore, demanding grassroots organizations literally subcontract under them to get the resources, but also functionally and epistemologically, grassroots organizations become appendages of their epistemology and their practices, not giving the space for grassroots organizations to actually get the resources and iterate and experiment and grow the indigenous methodologies for treating addiction and violence that we have been cultivating for decades. So that's where the critique of the nonprofit industrial complex and the role of the public health establishment plays, and that connects to both issues.